The first order of operations is mobility. Without the ability to move, you cannot perform any stability or strengthening exercises correctly. So we start with mobility, we go to stability, and we finish with strengthening. The first exercise, which I consider part of the normal everyday oil change for our physical body, is using the foam roller. A lot of people will find this very difficult depending upon the amount of scar tissue and adhesions and hypertonicity or stiffness they have in their body. It's important that when you do these exercises, you maintain a certain level of discomfort, meaning challenging the tissue to change, but that you don't go into pain or feel, for example, any sharp shooting pains indicating that you might be moving something or pinching on a nerve. We can start with smaller structures, such as a smaller 3-inch foam roller. It's very squishy. I'm going to start with a rigid 5-inch roller. But some people may need to start with 2 towels rolled up into a cylinder and twisted. Of course, that's going to have some give and squish down. And then you could proceed to wrapping a pool noodle or a smaller foam roller inside of a towel to provide a little core, but with a towel around it to soften it. Some people will be ready to use a hard or rigid roller like this, or the black ones or the white ones that many people have. But if it's too tender on your tissue, meaning that you can handle the arc, but you can't handle the pressure into your tissue, you can place a towel or some type of cushioning over that roller and then remove it as you soften up. Okay? So first way that we use the roller, it's very important, is that we're going to be laying across the spine. I'm going to find my last rib, which happens to be right here for me, and I'm not going to go below that. I will put that rib in the center of the roller. Bring my legs together. They're bent. I don't straighten them out. They stay bent. And I'm just going to lay back and I'm going to let my bottom come up. I want to practice relaxing into this and deep breathing. 2 or 3 deep breaths, and then we'll shift this roller down about the width of one roller. I'll reestablish my position, and once again, 2 deep breaths. As I do that, I'm going to move up the length of my body. Until I get to my shoulder blades. Once again, if you don't have shoulder problems and you can lift those arms, you can extend your shoulder blades up and get this arc, this posterior to anterior press on your spine. So we're trying to induce movement and get softness along all the musculature that runs along the spine, which is behind a lot of our posture problems. Okay, once this is not difficult, okay, I'll do this up the body and I'll do this back down. There may be 4 or 5 positions. Doesn't take very long. But once you're comfortable with that, what I will then do is add rotations. It may take you a week or 2 before you can actually add rotations. And this is what that looks like. So after I did my neutral spine, up and down, I'm going to lay on the roller and I'll let one leg fall to the side. I'll turn my head and maybe even bring my arms over to this side. So I'm really trying to rotate the spine. Take a deep breath. 2 times. Come back. And go to the other side. Let that knee drop and this leg is staying neutral. This is level 1. I'll do that up and down my whole spine. If that's comfortable, the next part will be using both legs. So I'll have done my neutral warm-up, and I'll let both legs simply fall. I'm not trying to force their contact with the floor. I'm just letting their leverage roll. Turn my body to the other side. 2 deep breaths. 2 deep breaths. Back down. Some people will find that they are good to do the neutral on a larger roller, and they may have to dumb down the size of the roller to add the rotations. That's fine. Everyone's going to be different. Everyone starts this process at a different place. Everyone's spine and musculature is different. All right, you'll take 2 deep breaths at each level. Once again, you'll proceed all the way up to the shoulder blades, and you're done. This effect is really noticeable to me as a practitioner after patients have done it for about 2 weeks. I can literally come in, touch their back, and aside from them reporting that their symptoms have improved, I can feel the softness and the suppleness returning to their tissue. And when the tissue is softer, you get more motion, more circulation, and you're on your way to less impingement. Once we've foam rolled on the back, there's a couple of the corners of the box, of this frame, that we want to work on. A big one is going to be the hip. After we loosen up the spine, we're going to get our roller. And once again, you may be using towels on your back, but you're going to need a rigid roller to do these corners. A towel's not going to cut it. So I'm going to place my hip, okay, if I have sciatica, low back, or sit a lot, this is very good. I'm going to place my hip, my glute, on this roller, hands on the floor. I don't want to fall off. I'm going to cross my leg. Now, if you can't cross your leg because you're so tight or you're fixated or you have hip problems or hip replacements, keep your leg down here and leverage your weight. I might rest on my elbow, I might rest on my hand. That's up to your comfort. And I'm going to roll on this hip, and I'm going to rotate my body to make sure that I get every structure I can on this backside. And I'm going to come high up onto my hip bones, almost to the low back, where all these attachments are. Anywhere that I find a grisly, tight, sore spot, I'm going to spend a few extra moments getting that. Now, when I cross my leg, that stretches these structures and makes this rolling even more effective. And I'll look for these spots, and I'll work them out. And you know when you got it, when you can't control the contortion of your face. So take a few moments to do both sides. Okay? Again, place the hip we're working on. I can keep the legs on the floor. I can just roll it back and forth, turning forwards or back to get the 3 dimensions of my hip and glutes. If you can, bring this leg up into a figure 4 position and work the side, the back, and the bottom. The other corners we're concerned with are going to be the shoulder. So for all shoulder problems, neck problems, and thoracic problems, we're going to work behind the shoulder here where our lats, teres minor, teres major, and the infraspinatus all cross. This is really good for shoulder problems, but once again, if you have an impingement syndrome, you're not going to raise this arm up and create pain. You're going to keep it down to where you don't feel any sharp or burning sensations. Okay, so I might start off low, putting this right in my armpit, and in this, doing the shoulders, you have to roll back a little bit so that you'll be looking up a little bit to the ceiling. This places your backside on top of the roller, letting you use gravity and your weight to get this compression and roll. And once again, you'll see that I'm moving forwards and backwards, looking for sore spots. You'll make some faces, and I'll actually move down a little bit onto my ribs following that lat. Okay? Now here's a good modification for this. Once again, you find a sore spot, massage it back and forth in a small range of motion for a few seconds. I'll pin this tissue so that I can do a home version of ART on this region. And I'm going to stretch and reach. And I'll come back. I'll pin the tissue and I'll stretch and reach, holding it and prompting it to do a assisted stretching technique. And that will also help to stretch and open up the tissues that might be binding the upper corner of the torso. Okay, let's talk about foam rollers. Foam rollers come in all shapes and sizes. up until a couple of years ago, we didn't really have many options. You had the option of a hard or softer 6-inch foam roller, blue, black, and white. Nowadays, you have these standard rollers. You have these specialty rollers, and you have other options like on Amazon, these little 5-inch rollers. Some come with knobs, some are soft, some vibrate. None of that's important. What's important to us is that it's fairly rigid. Of course, if you're really stiff, you're really tender, your problem is really acute, you may need to start with a towel rolled up and twisted to use that in place of the foam roller. Once that is more comfortable, you might go to 2 towels, twisted up hard, but still forgiving, softer. You might put a pool noodle inside of that towel and wrap it up, so now you have a core with a softer covering. And then you may even move up to simply like a 4-inch, more forgiving foam roller, eventually a 5-inch roller, and maybe you'll get to a 6-inch roller. Now, at this point, I believe that because we have options, the 6-inch roller, its diameter is a little much for how we roll the spine. Okay, a lot of people have this roller, so we demonstrate upon it. But I think it's a little too big, and especially as we move into an older population and people that have a lot of deterioration or long-standing tightness. So I think really the 5-inch roller is as high as I like to go nowadays. So I really recommend people consider that and just monitor their level of comfort. My personal favorite that a patient turned me on to were these rollers from Knotout, knotout.com, actually theknotout.com. And they make these hard, rigid, heavy-duty rubber rollers that allow me to do a lot more than a traditional roller. And then it has these grooves, and I can place various parts of myself in these grooves, like when I'm doing that lat rolling, and really get a much bigger effect because I have this dip that allows me to get around the muscle. This is really great when you're doing your abductors. Fabulous when I'm doing my hip because once again it acts almost like a softball, so that because it has that rounded surface area, it can really get into a lot of structures more than the straight flat roller. But a roller like this will run you $100, and if you don't see the value in that, I wouldn't expect you to buy one. But I want you to know they're out there, and everyone that has made that leap really sees a difference. But all of these rollers are fine. You could even, in traveling, wrap a water bottle, make it a metal one, not a plastic one, don't break your water bottle, into a towel and use that on travel. So really, use your imagination, but always use comfort and never go into pain. Now, challenging yourself is different than pain, because anytime you challenge yourself to change, it's going to be somewhat uncomfortable. And that's the difference of a good stretch or a good ache versus being in a position that you're actually causing more impingement and firing your pain or causing damage. Because pain is a signal that you're hurting yourself, and that's why your body's creating it. So don't hurt yourself. We're here to help ourselves.